Hi everyone, welcome back to my channel. New viewers, welcome. Today I'm going to be talking about a slightly more serious topic. I feel like sharing my experience might help a lot of other people who might find themselves in the same situation. We're going to talk about you. It was the first summer of the pandemic and it was at the height of the restrictions. Restaurants, gyms, everything was shut down. So we picked up jogging. Roxy and I would go jogging at least twice a week. So we would take the main road to jog all the way down to the beach. On the way back, we would take this different road. My friends and I actually call that road the creepy road because there were no lights when I used to live there and it was completely dark at night. One side of this road, there are vast fields. So I would let my dog off the leash and let him run around the fields. Once it so happened that he crossed the road and when he was coming back, a car hit him and he broke his paw. Luckily for us, the driver stopped and he got out to check on us, insisted and I pleaded for him to please take us to the vet, and so he did. Long story short, we went to the vet. The vet said that they're not able to perform a surgery and that we should take him to the hospital. I was very lucky to have my friend who I called. She came and picked us up and I'm so grateful to her. She took us to the hospital and waited there until the doctors could let us know what's going on. Roxy is fully healed, although his paw will never be able to bend all the way like it used to. But from the experience, I learned some things that I would like to share with those who might come across a tragic situation as such. First things first, and this is something that I learned from the vet at the hospital, told me that although he needs an immediate operation, they're not going to operate him right away, and that is because he went into shock. So when an animal goes into shock, it's best not to put them under anesthesia for the first 24 hours. It's just better to monitor their body and temperature and breathing. And once they calm down, then they can actually take him into the operating room. They kept Roxy for about a day before we took him into surgery. It's also good to know that there are different types of surgery that can be done based on how severe the broken bone is. In Roxy's case, they put in 2 metal plates on his paw. They had to put in 8 screws to hold it in place. It was definitely a scary sight. Another thing to consider is that the dog might need a second surgery, which was in my case after 2 to 3 months. The inflammation of the paw was just not going down, and that's because the body was rejecting the metal pieces. But by then the bone had healed more than 90% and they had another operation where they took out the metal plates and the screws, and then his paw healed perfectly. The second thing you must keep in mind at all times post-operation is to avoid higher ground. You do not want your dog to jump on the bed, on the sofa, nothing like that. What I did was to create a little den in the living room where I put the sofa cushions on the ground and I just stayed with my dog on ground floor, and I also stayed with him most of the time. If you have a job that you have to go to and leave your dog at home, I highly advise that you don't do that, especially for the first 48 hours. The third thing is to not allow your dog to run at all. You can take him for 2 to 3 walks a day, very short walks, because they do need to press their paw on the ground for the bone to start regenerating. Fourth thing to consider is supervision of the paw itself. So the bandage needs to be changed, the sutures needs to be checked. In his case, there was a bit of an infection, but that was ultimately because of the metal plates. It needs to be regularly checked and disinfected. If you're not able to do that, it's best to take him to the vet for the first week at least until the incisions are taken out. The fifth thing to consider is their sleeping environment. You do not want your dog to sleep on a hard surface, but you do not also want them to sleep on a too soft, cushiony surface. What I did was to buy an orthopedic mattress for him to sleep on so that the paw rests straight. If you can't afford an orthopedic mattress, you can just buy a normal mattress or kind of like a sofa cushion where it's just hard enough and just soft enough for them to be able to sleep on it without their arms sinking in or falling in an uncomfortable position. The sixth thing to consider is that your dog will need a lot more attention. They're traumatized. They're mentally feeling down. I was really lucky to have my brother who sent all of these toys from London for him, and it did cheer him up. He started playing with them after a while, and I would give him snacks and I would take care of him. It's a long process, and for them to kind of pick up emotionally once more, it takes time. The last advice I would give is to consider supplementation. After surgery, it's very likely that your dog will go through an antibiotics course that will really take a toll on your dog's digestive system. So it's really good to follow up an antibiotics treatment with a probiotic supplement. I also gave supplements for strengthening and regenerating the bones. In terms of food, it would include a lot of cartilage in the food and proteins to help restore the damage. Just keep in mind that a broken paw is not the end of the world. It can heal, and it will heal quicker than you can imagine. You just have to be very patient and give the time, care, and attention that your pet needs. And Roxy does not want to join today's video. He's just chilling. It's a rainy day, but here we are. Alright guys, see you next time. Bye.